their weight.
Okay, well, you could do it. Okay, I think we're now live, Dr. Myers. Wait, just wait, because it's showing me it's live, but it hasn't gone through on my end. Yeah, I think it's live now. You're on mute.
Good evening, everyone, and welcome back for another episode of Corona Conversations in the Black and Brown community. And today, we've actually reached a milestone of 1 year. Oh my goodness, it seems like we just started this a few weeks ago, Maya, right? Can you take it away with your wonderful PowerPoint so we can get started today with this evening of wonderful guests? I'm so excited. I was going to bring bubbly, but I didn't think that would be professional. And I have to get a shout out to a special viewer today. One of my patients told me, and I'm not going to give his name, but he knows who he is. You have a big day today. I said, huh? He said, it's your 1 year anniversary show. You should be excited. So you know who you are. He said he's one of our greatest fans. And like I said, I can't say his name, but he knows who he is. So shout out to him. For him and his him and his wife, they watch religiously. So I just want to say thank you, Mr. You know who you are. So yes, I'm just waiting for Maya to load it up. And I just want to give you a sneak peek for our next show, which will be in June. We have 2 wonderful shows. Our first show, we're going to deal with mental health because we know that's a serious problem in communities of color. So we're going to have some wonderful social workers, hypnotists, as well as psychiatrists to come on and address that topic. And our co-sponsorship is with the Northwell African American and Caribbean Burg. And then our second show is going to be in time for Juneteenth, where we're going to talk about Black doctoring. And we're going to have some of the GOATs who are Black and Latino doctors. So I'm looking forward to both of our shows that are coming up next month. That will be June 3rd for mental health, and then June 17th for Black doctoring. So you please join us for those shows, which will be at 8 p.m., same time, same place.
Are you ready? Do you want me to, can you see
Go ahead.
my...
Yeah, go ahead.
Okay.
All right.
Okay. So good evening and welcome to yet another COVID-19 Conversations. As Dr. Maya said, this is our 1 year anniversary and we're really excited. We didn't know that when we started this, it was rough. And so we're finally happy that we could have actually made it to 1 year. So as usual, I am Dr. Maya Williams and my wonderful co-moderator for the past year has been Dr. Allison Myers. The latest COVID-19 stats, we have over 42 million total cases. In the past 7 days, we have seen 6.23 rate per 100,000 cases, and the total number of deaths is slowly creeping up to 600,000. The latest COVID stats as it relates to the vaccines, thus far we have delivered over 349 million vaccines, 227 million administered, and over 47.9% of the population has received at least 1 dose, and 47.8% have been fully vaccinated. So a year ago, on March 11th, 2020, the World Health Organization declared the coronavirus outbreak a pandemic. The pandemic closed borders, it halted air travel, and emptied destinations for tourists. 1 in 3 Americans know someone who died from the coronavirus. And what really started this show was that as much as we were seeing that a number of individuals were dying from COVID-19, we were realizing that Black and Brown individuals were hardest hit, revealing a stark racial and economic divide that was brought about by COVID-19 pandemic. And we could see that more Black and Brown people than ever. And what we mean by that is, although we're not a majority of the population, a majority of the hospitalizations and deaths were that of Black and Brown individuals. And so our lovely panelists right now, Dr. Lindona Maras and her her co-authors, they wrote a wonderful paper on COVID-19 and health disparities that shows how COVID-19 was actually magnifying the effect of health disparities. And health disparities has been existing for a very long time. It was not often talked about, but it's just that COVID-19 brought into the surface the systemic racism that exists in healthcare and the systemic racism that prevented Black and Brown people from actually getting access to care. And so also during the year of 2020, we saw a lot of protesting around Black Lives Matter. We could remember Breonna Taylor, we could remember George Floyd. And so we saw Black and brown people dealing with actually two pandemics. One pandemic is the COVID-19 pandemic, and the second one was that of racism. And we saw healthcare institutions and healthcare systems around the United States were saying that they support Black lives. Everybody was coming out and saying that they support Black lives. But actually, 1 year later, what is being done? Has we seen any changes in the number of Black and brown people who are dying from COVID-19? Are we seeing any changes in the number of Black and brown people in leadership positions? Yes, we did make a number of strides, like we have a Black woman now as the Vice President of the United States of America. But the question that everybody's asking is, has anything changed? And so for the past year, we've done 26 shows. This is actually our 26 shows on COVID-19 conversations. And back when we started in May 17th of 2020, we were sponsored by the Black educators community. We had Dr. Alison Myers as a panelist. Returning with us now is Dr. Lindona Mars. And we also had Asha Cunningham, who was actually our second COVID-19 survivor on the show. And so 1 year later, what has changed? We see that we have a vaccine. And despite the vaccine and the availability of the vaccine, there's a lot of talk about vaccine rates lagging in Black and brown communities or communities of color. And a lot of individuals are saying that Black and brown people are hesitant to take the vaccine because of the mistrust that we have of the health system. But what we're seeing is that we do not have access to the vaccines. So vaccines are being in communities that we do not have access to. Vaccines are available at times that we cannot go to access the vaccines because we work all the time, or we are predominantly essential workers. And so the vaccines are available online. Sometimes Black and brown people, some of us do not have access to the internet to actually make the appointments that we need to make. And so we are not getting, it's not that we're hesitant, it's just that we do not have access to the vaccines. We also saw earlier this week, the CDC reported that fully vaccinated persons can now wear masks, which is something that everybody was looking forward to. But who are more likely to be fully vaccinated? Individuals. And again, that might be Black and brown people. And so individuals are saying that we should not have lifted the mask mandate if we do not ensure that the most vulnerable around us, who are the Black and brown people, are actually the individuals who could definitely are fully vaccinated. And that is when we could say, like, okay, we could return back to normal. New York City, 1 year later, earlier this year, I believe it was yesterday, Governor Cuomo reported that while it was initially said that we would be fully reopening on July 1st, we saw that on May 19th, New York was slowly reopening. And we could definitely see that individuals are now returning to work. And for those who haven't returned to work, there's plans of returning to work in the fall. Students are returning to school in the fall. Despite what's going on in the United States, 1 year later, COVID-19 has still continued to cause damage. If you're listening to the news, you should hear by now that India's COVID-19, India is now the epicenter of the COVID-19 pandemic, with the daily death tolls actually breaking a world record. I believe it was 2 days ago. The country reported 4,529 deaths in the past 24 hours, topping previous high rates set by the US in January. Also around the world, 1 year later, we saw that the La Soufrière volcano in St. Vincent erupted, and the people in St. Vincent actually right now are going through a natural disaster, and there is calls for individuals to help with the road to recovery. And Asha Cunningham, who is a native of St. Vincent and the Grenadines and will be a panelist on our show tonight, is actually calling for more solidarity to aid the island nation. And we're saying that we have to be ready and willing to be in this for the long haul. We have reached 1 year, and we couldn't have done that without a number of people. We'd like to thank Dr. Naomi Maria, who was one of the first persons who was the brainchild in this and helping us to, do the survey that we initially sent out. helping us to just sum up for support in whatever way she could and can help us and still continues to help us to this day. We have Tiffany having the Department of Medicine from Trial, who actually stood up for us, supported us, and make this happen for us, gave us the platform and the voice to be able to speak up about this. We have individuals in our audience who've been there with us from day one and have continued to be there for 26 of this. And we'd like to find the Asher Cunningham for sponsoring this event tonight and his business, Young Black Travelers. Also, you could feel free to support us by following us and sharing our posts and sharing the COVID-19 sessions that we have on Minority Health 3 and minorityhealth.convos. So tonight, our esteemed panelists, we have Mr. Asher Cunningham, who I've mentioned so many times tonight. So he's the Director of College and Post-Secondary Planning of the Eagle Academy Foundation, the founder of Young Black Traveler blog. So he's a young Black man, a young immigrant Black man, a young man from the Caribbean who's doing great things here in America. And he's also a COVID-19 survivor. We also have returning Dr. Donna Maras. She's an internal medicine and primary care doctor in the Department of Medicine at Northwell Health, an assistant professor at the Donald and Barbara Zucker School of Medicine at Northwell Health. And joining us a little bit later is Dr. Mangala Narishanhan. She is the Director of Critical Care Services and the Medical Director of Acute Lung Injury. And she's actually joining us right now. The Injury Center, the VV ECMO program at Northwell Health. And now I'd like to hand it over to Dr. Allison Myers, who is actually going to ask the questions tonight.
So I would like to start with Asher, because as Maya said, you were one of the first COVID survivors. And I just want you to first start off by telling your story and letting us know where you are now 1 year later. There have been so much talk about people being long haulers for COVID and how their lives were changed. So I wonder if you could just start off by telling us about that. Thank you.
Thank you. And let me first say, I'm so grateful for you guys to lend this platform and the conversations that you're having, because these conversations are impactful to the community at large and to minorities who need to hear stories and conversations like this. But particular to my story and me a year later, I would say, honestly, I haven't been one of the people who has had lingering effects or effects that I probably would have noticed, right? Maybe they're there, but I haven't really noticed them. Again, last year when I talked about discovering that I had COVID, it was because I was an asthma patient. Which was the reason why I was prompted to go to the doctor and try to get a lot of things fixed or checked out. A year later, I can't say that my asthma has even come back or any asthma symptoms. I'm breathing normal. So I think I'm grateful, and I thank God for that, you know, there are people I know who has had so many lingering effects, but I'm honestly one of the people who hasn't had any.
Yeah, no, that's definitely true. I think a large part of what happened is a lot of people said, oh, the mortality is very low, it's only 1 or 2%, but they don't realize that even if you survive COVID, like most people have, a lot of people do have lingering. You're one of the lucky ones. People develop blood clots. I have one patient who said, Dr. Myers, my lungs are like sponge, and she now has to use inhalers. She never had asthma. So you definitely are very lucky in terms of having the recovery and not being a long hauler. So this question is for Dr. Mangala. A patient asked, I'm recovering from COVID-19, but still have a very dry cough and my breathing hasn't gotten back to normal. What should I be doing? Now that we are a year plus into the pandemic, can you talk a little bit about this COVID-19 long haul? Mr. Asher said that didn't really happen to him, but can you explain a little more detail what that's like for patients?
Sure, and thank you for having me on. I really appreciate it. We are seeing a lot of patients that are having COVID long haul symptoms and are suffering after effects, not just breathing, but other after effects as well. So I think this is a real entity. I think that people should feel validated by this, that this is something that we are studying. There's a lot of NIH money being put into this to look at this long term. And it's a significant percentage of patients who've had COVID that are now suffering from shortness of breath and other symptoms, a lingering cough, insomnia, inability to concentrate, feeling like they're in a fog, new onset diabetes, lots of different things that we're seeing as a result of their COVID infection. In terms of the shortness of breath, my suggestion is to follow it very carefully, to see a lung doctor that can evaluate your breathing, to give you a real percentage of how much of your lungs are affected, and follow that over time. We expect that to get better. And if it doesn't get better, there are treatments that we can institute to help. There are studies going on that are looking at long-term steroids, and will that help these patients, and other inhalers, and will those help patients as well? So there's different options out there. I don't think we have all the answers yet, but I think if you're followed by somebody, you can at least get into that treatment regimen, and as things come up, they can help treat you. So important to be seen and followed, and the symptoms need to be followed as well. There's all kinds of testing that we're doing besides the breathing test, 6-minute walk test, symptom diaries. When do your symptoms pop up? Is it a hot, humid day, or is it every day? Is it at night when you're going to bed, or all day long? So lots of different ways that we can approach this. It's so important to be seen by somebody who knows about this.
Thank you. And speaking of symptoms, this question is for you, Dr. LaDonna. It's allergy season. You know, I know I want to pull my eyes out, my nose is runny, I have a scratchy throat. How can individuals tell if they're suffering from COVID-19, or is it just your seasonal allergies?
We're not we're not hearing you, Lindona.
Thank you. I was saying I appreciate the question because it does come up a lot. And I think for people who have seasonal allergies, who've had allergies before, which can be the itchy eyes, the sneezing, they are familiar with what those allergy symptoms are like. For some people, it might be new, and so they're not sure, wait, is this allergy or is this COVID? A lot of the symptoms with COVID is shortness of breath, cough, fever. And I think fever definitely is one of those things. If you have a fever, chances are you have some kind of infection and not allergy. And I think the other characteristic of COVID, the other symptom of COVID is the loss of smell and taste, which, believe it or not, is considered a neurological symptom. And so a lot of times if you experience that, that too is a sign that you might have coronavirus and not allergy symptoms. But either way, I think it's always safe to go, whether it's to your primary care doctor, and hopefully you do have a primary care doctor. And again, I am biased because I work in the primary care setting. So primary care, urgent care, it's always safer to get the test and know that it's negative, as opposed to taking the chance and being around family members and friends and potentially spreading coronavirus. So if you have symptoms and you're just not clear, at this point the tests are so readily available, the best thing to do really is to get tested.
And I'm glad you brought up primary care, because that's a very important point. Because at the height of the pandemic, a lot of people were scared to go to the doctor or to the hospital, so there was a decrease of health services. A year later, this trend, is it continuing in its outpatient settings, or are you starting to see more patients coming back that are sicker than ever?
Yeah, in the outpatient setting, patients are definitely feeling more comfortable coming back. But the thing is, those who are not comfortable, you're not going to see them, which I'm glad we have forums like this, because I think it's really important for people to know that every healthcare system, every office has a protocol that they follow in order to keep the patient safe. Whether it's you call when you're outside, you call, let them know that you're coming, they're social distancing the patients in terms of the flow into the office. If there is a waiting space that they use, they will, cross off the chairs to have the patients sit at least 6 feet apart. So there are definitely measures that are being taken within the clinical space to minimize exposure for those coming into healthcare. And so I think it's important to recognize that there are some conditions for which you have to come in to be seen by the doctor physically. The other thing that came out of the pandemic, especially at the height last year, was the increased use of telemedicine, right? So very rapidly, all of a sudden, healthcare systems had to move from in-person, face-to-face visits to seeing your doctor through video conference. And in the past, before 2020, that was in existence, but definitely not to the extent that it is now. And it's not going away because many patients see the convenience of it. And so there are times, yes, you can see your doctor through the computer, and that can be enough for a visit. So for some people who may be hesitant coming in, depending on what's going on, that might be an option, although it's limited. Still, when it's time to come in to be seen, I think it's important just to understand that there are precautions that the offices take to minimize transmission. And then the last point that I wanted to make is that the concern about being afraid of using healthcare services, there are some procedures, whether it's biopsy or surgery, there are certain things that really need to get done. So I'm really fearful for people who, I don't know, maybe your doctor told you that you needed to have a biopsy of your breast or some kind of lesion that's questionable what it is, that can only be done physically in the hospital in a healthcare setting. So things like that you have to come in for. If you have to go for surgery, even in the pre-op setting, they will check for COVID before you go into the surgery. So there are a lot of protocols in place to keep patients safe. I recognize there's a lot of stigma around, having COVID and spreading COVID, but it's actually as important, still important, if not now than before, to make sure you're seeing your doctor, you're doing your preventative screenings, and the things that were lingering before COVID came, especially if your doctor told you to follow up, it's really important to follow up and to follow up in person at times.
Thank you. So we often talk about physical health, the impact of COVID on physical health, but we also have to think about mental health. So I'll put this to our COVID survivor, Mr. Ashore. What have you done to maintain your mental health, between being on lockdown and the possibilities of the like LaDonna mentioned, Dr. LaDonna mentioned the neurological effects. There's also been psychiatric effects. What have you done to maintain your mental health during this time?
Yeah, that is a great question. And I also do a podcast with Young Black Travelers, and that's been part of the conversation that we've had over the past year about mental health. Obviously, I'm a traveler and I like to get away. That's one of the ways we escape, or we escape our normal life. And I think at a certain point, last summer, I think was a breakaway point for many of us to start realizing that we could at least get out, right? So I think after last summer and realizing that it probably isn't, it is bad, but we can actually do things distance and safe. So I started to last summer go and hiking. That was one of the ways I started to at least get away, or doing some local trips away. I probably became a little bit bolder by, even going abroad, and I started to work remote. I went to Colombia and I worked there remote for some time. So I think for me, that was one way for me to get back to a sense of normalcy, and a sense of safety. But even when I was doing that, I still observed a lot of protocols, and a lot of these international countries they're very stringent about what they do and how you do a lot of things. So for me, honestly, even when I went away earlier this year, getting away was a way for me to just put my mind back to a place of safety, and some sense of normalcy, and for me to be okay.
And you're lucky you were able to come back, because I have a coworker whose father went home to Colombia to visit just before a pandemic, and he wasn't able to come back to the States until November. He was supposed to come back in March, and he couldn't come back till November. And I also saw a patient today who had gone home to El Salvador in November of 2019. He came back March of 2021, because I was like, I haven't seen you. He said, yeah, I've been stuck in El Salvador. So you're lucky you were able to go and come back. Everyone, unfortunately, didn't have that luxury due to border closures. So
Exactly.
welcome back. I'm glad you made it back in one piece.
Thank you.
And, we've been seeing reports that COVID may have this kind of seasonality to it, like we see with the flu. And this question's for you, Dr. Mangala. So looking back and now going forward, do we expect to have a summer where we can get outside and enjoy things, and then we kind of have to chill out in the fall because we think there's going to be kind of this seasonal approach to this disease?
I think we're learning, and I think that is the case. Last summer, we definitely saw a big decline in our COVID rates during the summer, and it came back with a vengeance in the fall. So I think that's probably what's going to happen again. I'm hoping the fall resurgence won't be as bad because of all the people who are now vaccinated. I do think that there are people who got vaccines in December and January, and there's some question about how long that efficacy of those vaccines will be, and will they start to wear down. There's talk of a booster shot that will be coming out in the fall for COVID, and some companies are talking about a combination flu and COVID shot that will be taken once a year. So more to come on that, but I am expecting a quieter summer and some amount of resurgence in the fall, yes.
And speaking of vaccines, Dr. LaDonna, this question I'll pose to you. We've been seeing, even though there's lots of vaccines available and they're doing all types of things, Ohio's putting you in a raffle for $1 million. If you're under 18, you can get entered into for a scholarship because they just have all these doses of vaccine that nobody's taking. We still see disparities in communities of color. So for those who are reluctant to take the vaccine, what advice would you give them?
Yeah, I think this is a great question. We could spend the whole hour on this topic, but the way I think about it is, when we think about communities of color, we recognize that the history of the United States has not been so kind to, Black people and people of color. And so when we think about individuals who may not want to take the vaccine, many have very strong reasons for, being hesitant. And I know hesitant is a loaded word when it comes to next to take the vaccine. So I think about it as there are some people who jumped on board, who said, as soon as it's available, I'm going to take it because I need the protection. Then there are a bunch of people who are in the middle and are just saying, I'm gonna wait and see, right? They're not saying yes, but they're not really saying no. I just want to give it some time. And then you have the camp who absolutely not, no matter what, I don't care what scholarship, what raffle you put me in, I am not taking this vaccine. And so whenever I see a patient in the office, I just ask them, like, where are you in the spectrum? Where are you on this continuum? And my goal is never to convince someone that you must take this vaccine, right? Is your body, you decide what you want to take into your body. Obviously, all I can do is give you information and also hope that you are getting information from a trusted source. So my concern, sometimes is that there are a lot of myths, a lot of sort of false beliefs about the vaccine. And I think it's important for us to, like, in forums like this, really talk about it. Let's talk about, what people believe about the vaccine, how much of it is based in science, and how much of it is, just not plausible. So for example, the most recent one is the idea that when you get the vaccine, they're implanting a chip in you, and you're going to be followed around or something. And when I think about it, I'm thinking, really, this liquid is going to go in your body and form a chip and follow you around? That's just not plausible. And then I would take out my phone and I would say, it's going to follow you around. This phone, you're going to be tracked by your phone, but you're not going to be tracked by a chip that's created from the vaccine. So that's one myth I try to dispel as often as possible. And then the other one that's been coming up a lot is the concept of infertility, that the vaccine will cause women of childbearing age to either not be able to have kids or some kind of problem with the reproductive system. And this vaccine, like any other vaccine, it's just not plausible. The mechanism of how it works in your body, what it's set out to do, is really to boost your immune system so that when you are actually exposed with the true coronavirus, your immune system has already seen it through the vaccine and will rev up to fight it. There isn't a mechanism for it to then go into the reproductive space and alter your DNA. It's not physiologically, it's not possible, right? It goes into the body and then it's degraded, and then your body does the rest in terms of creating the antibodies. So these are some of the myths, and I know there are many more, but for those who are hesitant for these kinds of reasons, I really want to encourage you to have a conversation, not with your cousin or your friend, but really with the healthcare provider, just to make sure you're getting information from a trusted source. And then there are obviously other websites, whether it's New York State website or cdc.gov, which really tries to make the information very user-friendly and accessible. But I really encourage everyone to get the most accurate information possible.
So not someone who has a WebMD degree.
Right, not a Dr. Google MD
Right.
degree.
And I was gonna say, I was not the first in line to get vaccinated. I did get vaccinated, but I was one of those middle of the road people. I'm just gonna be honest. And what I think was my turning point and was like, okay, I'm doing it because I live by myself, so it's very easy for me to keep to myself. But when I read that COVID can stay in your brain and cause all types of cognitive impairment over long term, I said, that's it. If I get this, I may never be able to work again. I need my brain. So I think that was kind of that between that and the blood clots. I think that was just like when I was just like, you know what? I want none of the above. So I think those were probably the two things that really concerned me the most about getting COVID and what made me get the vaccine. So I do the same thing. I tell people, let's look at the benefits of getting COVID versus the benefit of getting the vaccine. If the benefits of getting the vaccine outweigh the benefit of getting COVID, then you should get the vaccine. And it's not, I don't want to say it's funny, it's ironic. There's a couple of people who were like, I'm not getting it, no. And then they ended up getting COVID. So, some people unfortunately have to learn it that way, which is an unfortunate thing. You don't wish it upon anyone.
Right.
But, some of the people I know who are really adamantly against it, I know they ended up getting COVID and they unfortunately ended up in the hospital. Speaking of which, I was hoping that Dr. Mangala, you can comment on what are the medications that can be used. I think, unfortunately, there was a lot of misconceptions in our previous administration about the cure for COVID, curative treatment, and what this medication remdesivir does. So if you could talk about what are some of the treatments, I know you briefly touched about the Decadron and steroids. Can you talk about what the treatments are and this whole FDA approval for remdesivir and why that was the
Sure.
one drug approved?
Sure. It was a learning experience for all of us going through this for the first time. And there was a lot of unknown in terms of medications. So we learned through the pandemic. But I think what we do know now is if you have very mild COVID and are not having problems with your oxygen levels and not having problems in general and just have mild fevers, there's really no medications and it's really just waited out, just like you would with a regular cold. If you have COVID that's a little bit more severe, requiring you to go to the hospital and your oxygen levels are dropping, then you should be treated with an antiviral medication that is remdesivir, which works to stop the virus from replicating and to prevent you from having worsening symptoms of it. Now, if you get to the point where you're requiring oxygen, the recommendation from many large studies is many large studies is to use steroid treatment to prevent furthering worsening of your lung disease. So it really depends what your COVID looks like, how bad it is, and what you need to do. So start with nothing for mild, and if you're more severe, remdesivir as an antiviral and steroids in combination with that. And if you have very severe COVID where you're having a very bad inflammatory reaction, your body's having a reaction to the virus, there's other medications that we use to stop your immune system, such as tocilizumab. And that in that very severe population seems to help as well. So depends on what your COVID looks like and where you are, if you're home or in the hospital. But remdesivir is a very good, safe antiviral medication that we're using. And all of the other drugs that were previously thought to be helpful, hydroxychloroquine, azithromycin, we've stopped using all of those. There's no evidence to show that they're helpful. And the same thing for ivermectin. There's a lot of internet buzz about that. There's no evidence to prove that it does anything for COVID, so not recommended at all. So basically the two drugs that we use are remdesivir and steroids. And if you're very severe, something like tocilizumab as well, but that's it.
Yes, and the steroids have definitely kept me busy at the hospital.
I bet.
Between COVID and steroids, the blood sugars have been
I
out of
know.
control.
I know.
So you guys have definitely kept us busy. I'm so glad the numbers are going down. Thank
Yep.
you. So just shifting gears, we focused on the science. I think now it would be good to talk about what's going on. People are outside. So recently, the CDC has said that if you're fully vaccinated, you don't have to wear a mask if you're around other fully vaccinated people. So Dr. LaDonna, what do you think about that?
I feel like that's a setup. I'm going to echo the sentiments of many people that were, surprised that they made this recommendation. And I know there's a lot of talk of whether or not it was done too soon and what's the rationale. And it's really not clear what the rationale is. And maybe it is trying to promote individuals to get vaccinated. But overall, the goal is to get as many people in the population vaccinated, right? If you're going to take the Johnson & Johnson, that is getting the single dose. If you're going to take the Moderna or Pfizer, obviously it's 2 doses for it to be effective the way it was in the trials. And we know that's over 90% effective. And then we wait about 2 weeks after you get that second dose, because that's the amount of time it's going to take for your body to really ramp up and create those antibodies to be considered fully vaccinated. And I think it's it's a personal choice. I think many people still want to feel safe, and so they're going to continue social distancing and wearing the mask. And the CDC has its recommendations, and obviously they have a lot more data than the rest of us may do. But I think it really becomes a very sort of regional, sort of local, and definitely a very personal decision.
And, Mr. Usher, you're not a local or a national, you're an international traveler. So now that the world is seemingly in some places opening up, in some places closing, like our poor people, our poor friends in India, unfortunately, they are closed off. But other countries are gradually starting to open back. So many people are willing to say, you know what, let me travel, let me see the world. So based on your expertise, what does travel look like a year later? Because about a year ago, nobody was flying. The airlines were doing dismal business.
Yeah, so travel a year later is how travel was before COVID. And I think, for me, it was a bit scary. I think when I came back from Ecuador a month ago, and to sit on a JetBlue flight filled with people, right? I think I'm even though I'm okay in going out and exploring the world, and I think we all we shouldn't be stuck inside and be afraid to go outside. I do think there's a lot of precautions we still need to take, and I think on the plane that was the hesitant that I felt being on the plane with a lot of people right next to me. I do believe the planes are safe. I mean, the filtration systems and all of that. But I would say travel, when you do go to a lot of countries internationally, they are taking a lot of precautions. As I said, when I've gone to Colombia, when I've gone to Ecuador, people would tell you to put on your mask. Before you get into wherever you're staying, there's a lot of sanitizing stations everywhere I've gone. I think I've seen more precautions internationally than here in the US, to be quite frank. And that's why I would have said I felt safer in Colombia than being in New York, because I just felt that people took it a little bit more seriously. They a lot of times, sometimes I had my mask down, and they would tell us to put on our mask. So I think travel a year later, people need to take a lot of precautions. Obviously, carry your medications with you. When I travel, I'm walking with hand sanitizers. I'm walking with the Lysol wipes, and I'm wiping things down. Before going on the planes, I probably wasn't wiping down the plane seats, but now I'm wiping down the trays, because those are things that make me feel a little safer when I'm at restaurants or wherever I'm going in another country. I carry my hand sanitizers with me, though they'll have them there. But honestly, I'm not going into congregated settings, and I'm not being around a lot of people. I wear my mask and just try to take precautions. I think that's how it is a year later, and that's probably how it may be for another year or two.
Hmm. Yeah, and I mean, I've only flown once since pandemic, and that's when Delta still was blocking the middle seat. And I just got my upgrades and I sat in first class, and that made life easier. But you don't always have those luxuries. When the plane isn't super full, you can get an easy upgrade. But that was what made it nice. But now you might not have that luxury, because now that people are starting to fly again, now the middle seat is being filled up again, and the
Mhm.
planes are filled. I know someone who flew, I think it was in March, and they said the airport was packed, the plane was filled. When was the last time that you flew?
Yeah, I flew. So the last time was from Ecuador a month ago, and I think the
Mm-hmm.
surprising thing for me was, they were taking a lot of precautions, but it seemed counterproductive in a sense where, they minimize the amount of people coming to the airport because they have all these precautions, but then you still had to get on a line where people were crowded on the line, standing right next to each other, and I'm standing there like this doesn't make any sense because, and also when I went to take the COVID test in Ecuador, I felt safer in Colombia than Ecuador, by the way. When I was in Ecuador, I remember going to take the COVID test to get back into the US, because it's a protocol to get back into the US. And when I'm at the location taking the test, first of all, it was quite crowded. And then I'm in the location and someone is coughing in that area. And, you know, I think everyone there, I think, people weren't necessarily in hysteria, getting up and running around the place. But I think in all of our minds, that's the only time that I think if I was about to get COVID, it was in that line. And I felt they could have taken other precautions by removing the person from the line, or just doing different things. But those were the little things that made me feel a little uncomfortable. But you know, a lot of things these days seems to be counterproductive sometimes. But yeah.
Thank you, Asha. And I have a question for you for individuals who sort of like to travel pre-pandemic and now want to travel back. What guidelines should they follow, or how should they go about planning their trips? Like, how do they know where it is that I should go to travel? I know some people, like Dr. Maya said, like some people travel out, but they cannot come back in to the country. So how do you know like what precautions that you should take or what you should take with you while you're traveling?
Yes, I would say first you should check to see if the countries are open, because that's where you should start your search. So I usually, I'm going to a country or I'm thinking about a country, I'm looking to see what their requirements are on entry. A lot of countries do require the COVID test to enter, and a lot of them do. The language is different. So some of them may say 72 hours before, some of them may say 3 days before. And I think for a lot of people, they're confused on what that means. And a lot of people, when they hear 72 hours, they automatically think 3 days. And when they say 72 hours, they're actually talking about from the time you're going to the airport, you should have taken the test within 72 hours. If it is 73 hours, you're not going to be able to board that plane. And I've seen a lot of people turn away because of that one little stipulation. Also, I would say, just make sure that you know the difference. There are doctors on this Zoom this evening. Know the difference between a PCR and an antigen test. I think the first time when I was breaking out and going to Colombia, because that was my first trip, probably for over a year. And at that time, I didn't necessarily recognize the difference between PCR and antigen. And in my head, I remembered seeing, because I was taking tests before, and I used to take the test at CityMD. And, I think I thought that all the tests were the same. And so I remember before I was going to Colombia, they say you need a test usually 2 days. The results come about 2 days before. And so I was going to Kings County at that time to take the test. And I remember being on the line and them saying, oh, it's going to take 2 days. And at that point, I'm saying to myself, well, I could just go to CDMD where I can get the test in an hour. And it was the nurse who asked, so are you traveling? And it was then that she said, well, there's a difference between the tests. And that's when I realized, oh, there's a difference between PCR and antigen. And so had she not made that distinction, I wouldn't have known the difference between PCR and antigen. So there are people also taking the antigen test when a country may require the PCR test. So know if they're asking for the PCR test, take the PCR test. And sometimes when you're in an international country, know that to come back to the US, you actually do not need the PCR test because the antigen test in an international country will be more expensive. So might as well you take the antigen test and get back into the US. So I think those are some of my recommendations. Look at the language of what different countries are using and read those carefully before you book your trip, because a lot of people are getting in a lot of trouble because they did not read carefully or they don't understand, to be quite frank.
So I'm glad you brought that point up. And so I'm going to have to pose this question to Dr. Mongol and Dr. LaDonna to help me with this. I had a patient her husband was in a Caribbean island. Before he came back, he wasn't feeling right. He took the rapid, the test that you're referring to as the antigen test, Mr. Asher, and it was negative. He comes back, he still ain't feeling too great. Got on the plane, came home. 3 days later, they call the ambulance, they take him to the hospital, his PCR is positive. So either Dr. Lindana or Dr. Mongala, can you comment on the difference between the two tests and which test is better? Because is one maybe better than the other, even though one is rapid?
You can go ahead, and I'll jump in if there's anything I need to add.
Yeah, my understanding is it has to do with the term we use is how specific, like how accurate the test is, and the PCR ends up being the test that's sent out. So it takes like a few days, about 2 days for the result to come back, and that one tends to be more accurate. Whereas the rapid test, the result does come back in a shorter period of time, within a few hours. So you get a result, but the question is, how much do we believe that result? So that one has a lower rate of accuracy.
That's absolutely right. And it definitely depends on the pre-test probability. So if you have symptoms or you were exposed to someone, then you should definitely not believe that negative test if you get it from the antigen test and go on to get the PCR. But if you're just, asymptomatic completely, had no exposures to anybody, that's a different thing. And it really depends why you're taking the test. Is it a random screen, or were you exposed to somebody? Or are you feeling symptoms? But definitely the PCR is more accurate and is the more serious test. So if you're having surgery or if you're having something else done, they usually are requiring a PCR test.
Thank you. And this question is for Dr. Mangala. Earlier on, you mentioned the use of remdesivir and steroids for treating individuals. And I was listening to hear if you mentioned anything about, and even for the long haulers, like individuals who are on the ventilators. And I know before, being on the ventilators was such a big thing. Like everybody was talking about, oh, if you go on the ventilators, then there are chances that you might die, that it might affect your lungs. Could you tell us, like, what are the trends that you're seeing in the hospital right now in terms of individuals who are on the ventilators, and how do you treat the individuals on the ventilators? And I know this is a long-winded question, but what is the effect of the ventilators on, say, an individual's lungs, or in the long term?
So I think over time, we've gotten better at treating COVID, and we have a better understanding of what it does to your lungs. We're trying not to use ventilators until we absolutely have to. So we do things like high flow nasal cannula, where you can get a lot of oxygen through your nose. We do things like BiPAP, where you wear a mask and we help you breathe with the mask on. But if those things fail and you need to go on a ventilator, you shouldn't be afraid to go on a ventilator. You should do what you need to do to support your lungs and support your breathing. We've gotten better at treating people on ventilators as well. We know how to protect you while you're on the ventilator, and it takes some time sometimes. We know that COVID patients take longer to come off the ventilator than our traditional pneumonia patients do. So patience time, careful ventilation where you're not over breathing the patient, and we do very small volumes so that we don't hurt the lungs. And we wait. We do steroids, we do remdesivir while you're on the ventilator, and we give your lungs time to heal. We help support your breathing while your lungs get better. And then when your lungs get better, we take you off the ventilator. The mortality when you're on the ventilator is definitely better than it was last year at this time. We are better at taking care of those patients. So it is not something to be afraid of if you need to do it, but we are really doing our best to try not to put people on ventilators by doing all these other things that we're doing now. So it's a combination of treatment, patience, time, all of the treatments that we give people, and we wait until they're ready. And sometimes that takes a week, and sometimes that takes 2 months. It depends on the patient. It depends on what their lungs are doing. And every patient's a little bit different. But I really think that this fear of going on the ventilators, and I understand why, and I understand how sick people got that last year at this time, but I think we're better, and you should not be as afraid as you were before.
Thank you for that answer.
And I think we've also unfortunately seen that the crisis in India, there's been a real shortage of ventilators where people pretty much go on for 4 hours of oxygen and then they have to come off because they're just running out of supplies. So I guess, you know, right now there's a lot going on in our home countries, whether it be in India, what's been going on with St. Vincent. So I just wanted to turn it to Dr. Mangala and Ashur about what can our community do to help the people that are suffering. So first, I'll ask you, Dr. Mangala, how we could help with the situation in India, and then Dr. Ashur, we could talk about what's going on, obviously, with the volcano.
Yeah, thank you for bringing that up.
Sure.
We're keeping a very close look on what's happening in India. It's a very sad humanitarian crisis right now. Unfortunately, what we're doing is sending supplies. We're sending PPE, gowns, masks, gloves, things that they're running out of. We're sending oxygen compressors so they can make oxygen from the regular air, and they can treat people at home, and they can treat people in hospitals with that. So just being able to take the regular air and make concentrated oxygen with it. We're sending thousands of those machines over as well. And sending over remdesivir, sending over, you know, basic medications to help people keep people sedated on ventilators, things that they're running out of. Unfortunately, it's hard to send people right now because of the way things are on the ground. It's just not a safe situation. Even vaccinated people are getting sick. So we're really just watching the situation from a distance, sending money, sending supplies, and doing the best we can to support them in any way that we can. We are available for telehealth visits, where many of us are 24 hours a day helping the doctors there with consultations with our experience of what happened here, trying to standardize protocols for them. But really they're missing equipment, oxygen and supplies, and trying to get money together to send that over. So that's how we're supporting them.
Thank you. And then Mr. Ashur, if you could talk about your efforts that you've been working with the unfortunate St. Vincent and Grenadine volcano eruptions.
Yes, and it has been quite unfortunate that the volcano has erupted, and it's a good thing that it has actually stopped erupting right now, and the people are trying to get back to a sense of normalcy. But what we've been doing, we've been raising funds, Young Black Travelers and other organizations in the diaspora and across the world has been raising funds to send to St. Vincent, because there's been over 20,000 people who has been displaced, and a lot of these people are in shelters. These shelters were not equipped to handle the people immediately. I mean, imagine this is a volcano that just decides to go off in, you know, in a matter of seconds. People was just rushed out of the villages and rushed into shelters in a time when COVID is a big scare for globally. Thankfully that, you know, there hasn't been many, or to my knowledge, many COVID outbreaks on the island because of this. But people are still in need of many basic supplies. So food, clothing, because a lot of people left a lot of their livelihoods back in their villages. A lot of the villages had been covered by ash, lahars, or pyroclastic flows. These are the things that came from the volcano. Thankfully, many any people hasn't actually died because of the volcanoes, but it's the effects of the volcano that is the problem right now. So over 20,000 people living in shelters, living in private homes. People have to supply a lot of these needs. And a lot of also St. Vincent was also a third world country, a developing nation. And, the government, is stretched at this point, especially dealing with a lot of the other issues that they have been dealing with. So our effort at Young Black Travelers has simply been to raise awareness and funds to the international community, speaking to the United Nations and just many different organizations to step up to help St. Vincent, because honestly, it's dire need. They're in dire need right now, and we also don't know what else may happen to other Caribbean islands because they also have volcanoes as well. So that's why we want to make sure that we're lending support, because we do not know who will be next.
Thank you for that, Asha. And I have one question for Dr. Mangala. It's along the variants. The individual asked, how about the double variant in India, which is contagious and is here now in the US? Should people be worried?
I think that's a fair question. I don't think we know the answer yet. They're looking at those variants to see how our vaccines hold up against it, the Pfizer and the Moderna and the Johnson & Johnson. We don't know what the results of that are yet. They do think there's protection, and they do think that the severity of illness that you'll get if you have been protected with those vaccines and then get exposed to this is probably going to be less than somebody who has no vaccine. But I think the answers are not fully in yet. We know that the South African variants and the British variants are protected by these vaccines, but I don't think we have the full answers on the Indian variants yet. So to keep an eye, and I think that that's one of the reasons why some of the flights from India have been closed off, because there's concern about this. I think we have to watch and see how things go there. I know that Pfizer and Moderna are both looking at this right now to see what the resistance patterns may be.
Thank you. And just before we end, I would just like you, Dr. Mangala and Asha, to just say, just provide some advice on the ways in which the public can help in India, like if we could donate funds, like what societies that we, or organizations or charities that we could reach out to provide help to, the people in India as well as the people in St. Vincent.
Sure, I will put it in the chat, but the ones that I know of that are very good organizations that are really sending a lot of equipment to India and to, are very reputable organizations are Pratham USA and Seva, and I put those in the chat. Both of those organizations are very reputable and have already collected, millions of dollars and are sending supplies already, have already sent thousands of concentrators and things. So those are the two that I know of. I'm sure there are many more, but these are two that I trust and are doing good work right now. Thank you.
You're welcome. Thank you.
Yes, and regarding donating to St. Vincent, Young Black Travelers has activated our platform to actually help with the work in St. Vincent. So we have actually connected with people underground who we are sending money to, who are actually doing the work underground and giving supplies, giving groceries, whatever the people may need. So basically you can Google Young Black Travelers GoFundMe, St. Vincent Relief effort, and hopefully that may guide you to the actual GoFundMe link for Young Black Travelers. If not, I could share it with you, Maya, and you can definitely disperse it to the community. But Young Black Travelers, I think, is a reputable source in making donations to St. Vincent and the Grenadines at this moment.
Yes, also the African American and Caribbean Burg at Northwell has used an organization called You Give Goods, where you can order toiletries and kits that are going to St. Vincent as well. So it's called You Give Goods, and it's tax deductible.
Thank you. And I'd like to thank our panelists tonight for joining us on our 1-year anniversary show. People are burnt out by COVID, but it's hopeful in that we have the vaccines and doctors like Dr. Mangala and Dr. Lindona and Dr. Allison, they're working very hard, or have worked very hard, to bring us to the point that we are right now, where the CDC, despite the backlash that they have received, that it is now safe for us to go outside. As Dr. Mangala mentioned, that initially we didn't know much about the COVID-19, but now we've learned a lot, that we could now better take care of individuals. Individuals do not have to go on the ventilator as much as we were seeing about a year ago. And we do have some medications in place like remdesivir and steroids that could definitely help people. And people should no longer be afraid, like the world is opening up. As long as we take the necessary precautions that we need to take, then we could travel safely, we could interact with our family members, we could see our family members, and even our coworkers once more, because now we're returning to work. And so it feels like there is hope for the future. And like Dr. Mangala also mentioned, that it might not be as bad, like maybe it might be seasonal, we might see a little spike, but it might not be as bad as we saw in the year 2020 and earlier during 2021. So there is hope. So I'd like to thank everyone for sticking with us for a year. We do not know the future of this. We hope to continue. And even though you're tired of COVID, our hope is that we bring you throughout the next year or the next couple of years or the next month, something different so that you could learn, because the main point of this was to provide information, like Dr. Lindona said. We do not make the decisions for you, but we're hoping to give you the information that you need to take back to your doctor to accurately inform your friends to make the right decisions of what's necessary for them and the family, as well as what's necessary for you and the family. Next 2 weeks, June 3rd, we will be having our show on mental health, which we know that COVID-19 has had a detrimental impact on the mental health of individuals. Not all of us is as fortunate as Asha to travel the world, but there are certain things, and I'm a big advocate of that, can't wait to start doing it. But there are so many things that we could do, like take a hike or probably travel locally, domestically, or whatever it is that we could do. We continue to want people to be safe throughout the summer. And on June 20th, which is close to Juneteenth, we will be having a show where we celebrate Black doctors or doctors of color with all that we've been through throughout the history in the United States. And so we hope that individuals can join us to see how we could diversify the physician workforce, because that helps in reducing health disparities, and how we could increase representation of people of color in the physician workforce, especially Black men like Asha, because we're suffering here with Black men not being represented in the physician workforce. So we hope that you join us. So thank you very much for sticking with us. Thank you very much for supporting us. Have a wonderful summer. Continue to stay safe, drink your water, mind your business, and continue to be Black excellence, people of color of excellence, and continue to do everything. Thank you so much. Good night.
Thanks,
Thank you.
guys.
Good
This was
night.
great.
Thank you.
I learned a lot
Thanks.
myself. This is wonderful.
It was.
You guys
Same
are always
here.
a wealth of knowledge. Take care. See you on the floors.
Bye-bye.
Good night.
Have a
Thank
good
you.
night,
Take
everyone.
care.
Welcome. Thank you.
Bye-bye.